Hi, my name is Dr. Chelsea Walton. I'm a clinical psychologist over here at the Wellness Center. And in honor of May being Mental Health Awareness Month, I'd like to share some information on mental health, identifying signs of mental struggle, fighting stigma, and highlighting some of the resources available in our community with you. And so just a little bit of history on Mental Health Awareness Month. It was first celebrated in 1949 and was commemorated by an organization now known as the National Mental Health Association in the United States. And so during May of each month, we focus on raising awareness around mental health struggles, mental health issues, advocacy, fighting stigma, and increasing access to mental health services. So what is mental health? So mental health is defined by the World Health Organization as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to contribute to their community. And a more holistic definition of health is that it's a state of complete physical, mental, and social well-being, and it's not simply the absence of disease or infirmity. And so mental health is health. When we think about health, we usually associate that with aspects of our physical health, like diet, exercise, getting medical checkups, blood work, things like that. But part of being healthy overall is to manage and do things that promote mental and emotional well-being. And so in talking about mental health, it's important to address the stigma that surrounds it. And so when we're talking about stigma, we can look at it at two different levels. So public stigma refers to negative or discriminatory views that others hold about mental illness. And so an example of a sentiment that highlights public stigma would be that people with mental illness are a danger to society, which is something that maybe we see in the media, but it's not necessarily true, but it helps to perpetuate the stigma that, those that struggle with their mental health, have a mental illness, are dangerous to society, or that we should fear those or marginalize those further that have mental health challenges. And then self-stigma refers to negative attitudes that individuals with mental illness hold about themselves as it relates to their condition. And so this is when those messages from society become internalized, and those that struggle with their emotions or their thoughts, their feelings, then start to blame themselves or harbor unhelpful thoughts such as, I'm incompetent, or, this is all my fault. And so stigma is really harmful because it is associated with people not getting the help that they need, being fearful of seeking out support for fear of what that will look like if someone were to find out, not sharing with family or friends or trusted individuals that, they have an emotional or mental challenge that they're trying to work through. And so it increases that social isolation, also makes some people more vulnerable to being bullied, harassed, victimized, and it further perpetuates unhelpful beliefs such that, the circumstance, the experience that a person is having is one that cannot be improved or cannot be overcome. And so stigma, mental health stigma in particular, really undermines overall health. In thinking about our health, we have to consider different elements of our health, such as the physical, the mental, emotional, the social, and there are other elements too that maybe we haven't highlighted in this presentation as well. But that mental health stigma does prevent individuals from being able to engage in health behaviors. So behaviors that are going to help to improve their health overall, getting the necessary follow-up or preventative care that they need. And so stigma really does impact a person's well-being overall. In terms of their mental and emotional well-being, it's contributing to reduced hope, lower self-esteem, increased psychiatric difficulty, and difficulty functioning at home, at work, at school, or in social settings as well. And it does reduce the likelihood that individuals will seek out treatment, and then once they're receiving treatment and support, that they'll stick with it. But there are things that we can do to help reduce stigma. And some of those things include having conversations about mental health, educating yourself and others, sharing facts and experiences, and being mindful about language that is stigmatizing, such as, referring to people as psycho or nuts or crazy or using any of those terms that really do perpetuate the stereotypes that exist about individuals that may struggle with mental health and continue to perpetuate that stigma. Show compassion for those with mental illness. Normalize getting treatment. Let's make that something that's okay, right? That if you're not feeling well, you have a cold, you have a flu, or you're injured, you're more likely to seek out treatment from a medical doctor than you are from a counselor or therapist when you are sad, when you're down, when you're having difficult thoughts. And so helping to normalize that it's okay to see a therapist or a counselor or speak about the challenges that you're dealing with mentally or emotionally can help to fight stigma and make that less taboo. Choose to empower others over shame them. Provide support and be helpful and compassionate in your approach to others when they might be struggling. And so in terms of fighting self-stigma, so that's that internalized stigma that individuals who may be struggling with a mental health challenge face. If you are dealing with that, then the things that may help are seeking out information from a reliable source. So knowing that mental illness is personal weakness, being able to control it without any help is a common misconception. Try not to isolate yourself. Reach out to people that you trust for compassion, support, and understanding. And so there are many benefits to promoting habits and behaviors that promote mental health and mental wellness. And those benefits include being able to realize your potential, being able to better cope with the stresses of life and work productively, as well as to be a part of something bigger than yourself and contribute meaningfully to your community, and just a general sense of well-being and fulfillment that comes from having good mental health and being able to engage in things that give life meaning. And so there are some things that we can do to take care of our mental health in the same way that, we kind of touched on identifying some of the things that help to promote good physical health, like exercising, hydration, preventative care, rest, things like that. There are things that we know that are good for our mental health, such as developing healthy routines. So that might look like dedicating some time before bed to just relax and unwind, or maybe you journal or reflect on things that you're grateful for, or note things that you're concerned about that you can tackle the next day, or in the morning, being mindful of what your morning routine looks like, making sure that, you're not looking at your device first thing in the morning and being inundated with the news or things that are very activating, but instead maybe choosing to exercise or have your morning coffee or tea and breakfast, and just developing these healthy routines can help to kind of set the tone for your day and also kind of wrap your day up in a way that makes you feel a bit better and promotes reduced stress. Another thing that helps as well is getting regular exercise. It's a great way to buffer stress, and it is associated with having better sleep quality, which will also improve mood stability and being sharper, being better able to concentrate and think clearly. Saying no to being overextended. So we talk a lot about boundaries in this day, and this is a part of it, right? Being able to say no, not taking on everything or expecting yourself to perform at 100% in everything that you do. Monitoring and challenging unhealthy thoughts. So being mindful of the things that you're thinking, the things that, you're telling yourself, that inner monologue. Are you constantly critiquing yourself, putting yourself down? What are your thought patterns looking like? That can really influence the way that we feel and then the way that we behave and approach our life and our relationships with other people. Engaging in hobbies, so doing something for the sake of it, just because you enjoy it, you like to spend time doing it. There's no real end goal in mind, but you do it for the enjoyment of the activity. That helps to create fulfillment and enjoyment in our lives. Practicing gratitude, so thinking about things that you can be thankful for, even in stressful times, even in challenging times. There's usually something that we can be thankful for, grateful for, and it helps to make us more attuned to the positive things that occur in the day-to-day that we might just overlook. Prioritizing rest. When things get hectic or stressful, we're more likely to start to stay up later, to meet deadlines or wake up earlier. And so sleep is usually one of the first things to be deprioritized. So as much as you can, trying to prioritize rest. It's good for your physical health and for your mental and emotional health as well. Spending time with loved ones, whoever's in your support network, your social network, making sure that you're connecting with them on a regular basis, and that if you are struggling, that you're sharing that with someone that you trust and cares about you. And also when you have successes, share that as well with people that are in your corner and are part of your team. Avoid use of alcohol or substances. Those will tend to exacerbate mental health challenges and physical health challenges as well. And so while they're a way of self-medicating or coping for people, it doesn't help to resolve underlying issues. And so it's better to seek support, and that can include professional support, of course, if you feel as though it could be helpful to you. And so some signs of mental health struggles include changes in sleep or eating patterns, feeling down, feeling low, feeling overwhelmed, difficulty getting on with the things that you would usually do in the day-to-day, feeling hopeless or helpless, like things will never improve, like there's nothing that you can do to improve your situation or your experience, becoming withdrawn, not responding to friends or family members that you were close with and usually would, not feeling any sense of, enjoyment or interest in activities that you usually find pleasurable, having thoughts of death or dying, or engaging in intentional self-injury, self-harming, those are all signs that your mental health could use some prioritization. Other common signs of mental illness include a lot of physiological symptoms like stomach problems, frequent headaches, backaches, or other bodily aches, restlessness, rapid heartbeat, lightheadedness, dizziness, and shortness of breath or breathlessness. And so these can be symptoms of anxiety or panic. It's important to reach out to your GP, a medical professional, to have a proper medical exam done if you experience any of these symptoms, and to rule out any underlying medical condition. If you're struggling with anxiety and experiencing some of these signs or symptoms, then it can be helpful to reach out to a mental health professional, therapist, counselor, psychiatrist, psychologist, to address the underlying reasons as to why you might be experiencing these symptoms. And so there are a number of resources available in our community, from community NGOs to inpatient services and outpatient services, to psychiatry or counseling or therapy. And that pretty much concludes the presentation. And so if you would like to learn more, you feel like you could use some mental health support, just reach out to us over at the Wellness Center. Our contact information is here on the screen. And I hope that you were able to take something away from this presentation that you learned, or that you'll be able to use going forward.